David DeAndre, Andre Natural Health and colon osteopathy. What I'm doing here is just going to do a short video just to try and demonstrate the communication between myself and the patient. We're not necessarily showing technique, but the idea is to just show you the conversation that we have. This is a long-standing patient. He's due for an MRI. We're going to call him, let's say, John. And this is so you can see the kind of conversation that we have during your treatment, and I'm trying to manage your expectation. John, are you okay if I mention elements anonymously about your case?
Absolutely.
Okay, so John is awaiting an MRI. We think he's got quite a serious disc prolapse. It's affecting lifestyle. We've gone through it, so this is ongoing consent.
Absolutely.
Stop me if it hurts. Relax the leg, please. Just allow me to move that. Stop me when it hurts. That's quite interesting because that is one of the tests for nerve. We've gone through a couple of others already off camera. Remember, just let me know if there's any pain or discomfort. That was good. Here we go, shuffling round. And then we do the other leg. That's muscle tightness at the back of your hamstring. That's expected. Then we're going to do this little technique here. Any problem with that?
No, that's fine.
So remember, we do ongoing verbal consent. If anything feels uncomfortable or painful, you can let me know verbally, or you can literally grab my hand or say, oi.
No problem.
Okay. So I've explained how this technique works, and you've been here lots of different times, and so we're trying to balance things out using this method. There are lots of different methods out there. I'm a huge fan of testing bones, so
I can feel it on my left leg.
on your left leg.
Yeah.
Okay. So John is a really good patient because he communicates very clearly and frankly with me, so we can manage the expectation and have a therapeutic partnership. And this is what at this practice I really like to encourage patients to do, even if it means the patient, let me know if that hurts.
Yeah, that's fine.
And that's the phrase I do, let me know if it hurts. Don't suffer in silence. Let me know if you have an adverse effect, i.e. any pain, because it might be that I'm expecting you to be sore, but I haven't necessarily conveyed it in enough, in a way that you will say, oh, let me just check with the osteopath. Sometimes it's exactly what I think should happen, and sometimes not. It's really useful whether you see a physio, chiro or osteo. If you have pain after treatment, don't just go somewhere else. Tell the clinician, because we've often got an expectation of how you will resolve, whether it means you need an MRI, whether it means we refer you somewhere on. It's better for your overall care if, rather than putting up Peter against Paul, the physio versus the osteo, the chiro versus the osteo, the doctor versus the osteo, or whatever, we want everyone to work as a therapeutic team for you. So that is a really good point, as far as I'm concerned, for interdisciplinary treatment, and you get a better outcome. Here I am, pressing onto the groin. Are you okay? My hand's here.
That's fine there.
Okay. There we go. So each time I press on a part of the body that could be painful or sensitive, I will always check. We call that ongoing consent. And so this type of communication is ideally what we want to promote the good outcome, and I'm hoping that helps you develop an expectation of the best way to work with your clinician. I'm going to reach to the phone because I don't know how to stop it otherwise.